Hi, my name is Dr. Pavan Yadav. I work as a pulmonologist at Aster RV Hospital, JP Nagar, Bangalore. So today we are here to discuss about the option of lung transplantation, especially in people with end-stage lung diseases. So what is lung transplantation? Lung transplantation is a procedure wherein the damaged lungs are replaced with healthy lungs so that the longevity and the quality of life of the patient are extended and improved. So what are the conditions in which a doctor, a pulmonologist would recommend a lung transplantation? So there are certain conditions like, for example, COPD, which is chronic obstructive pulmonary disease, which is a condition which is often seen in smokers, long-term smokers, wherein the lungs are significantly damaged and they continue to worsen with passing years. This is one indication. The second indication would be something called as interstitial lung disease, wherein there is a scarring process which is going on inside the lungs for various reasons, and most commonly it may be in occupational exposure to dust, and it may be because of autoimmune conditions, and also sometimes we may not be able to identify the exact cause, during which we call it as idiopathic pulmonary fibrosis, and other conditions like chronic exposure to pigeon droppings and feather dust, which is called as bird fancier's disease. These are all few examples of an interstitial lung disease which, when progressing, may require a patient to continuously become oxygen dependent. Despite optimal medical management, if it doesn't respond well enough, then doctor, especially a pulmonologist who is well trained to manage such conditions, may recommend a lung transplant procedure. Right? And the third indication for lung transplant procedure may be something called as bronchiectasis, wherein the breathing tubes inside the lungs have become dilated and become enlarged in size, which leads to recurrent and repeated mucus impaction, leading to repeated respiratory infections and subsequent poor quality of life and weight loss and other symptoms. Apart from these, there are other medical conditions which are not very common, and some conditions especially called as pulmonary hypertension, wherein the pressure inside the vessels inside both the lungs are extremely high. It may be idiopathic or primary pulmonary hypertension, wherein no cause is known, or it may be secondary to an underlying lung problem itself. In such conditions also, a lung transplantation may be recommended. So people with such respiratory conditions who have advanced lung diseases because of any of the conditions which I mentioned may have to visit their pulmonologist, and also may have to visit centers which have these lung transplant facilities which are available and who can run advanced lung disease clinics, so that they can comprehensively evaluate you for your underlying lung condition. And apart from the evaluation itself, they can offer various other facilities. For example, you may need a pulmonary rehabilitation, and you may need a proper dietitian to take care of your dietary needs, and also you need proper amount of counseling regarding the extensive amount of information which goes with the lung transplant process itself. For these needs, you need to visit a specialist center which can take care of all of these issues in a comprehensive way, and you can get benefited from this procedure. Thank you.